Welcome to the place where we gain knowledge through the lens of creativity. I am Aaron Dworkin, and this is Artful Science. Thanks again for joining me here on Artful Science. Today's show is Pandemic Aftermath, the anxiety and depression of COVID. And my guest is John Greden, who serves as and this is in extended titles, Rachel Upjohn Professor of Psychiatry and Clinical Neurosciences, active Emeritus, founder and director of the University of Michigan's Comprehensive Depression Center, Emeritus Research Professor for Michigan Neuroscience Institute, active Emeritus, founding chair of the National Network of Depression Centers, and chair emeritus of the University of Michigan's Department of Psychiatry. John, it is so great to have you on the show.
Aaron, it's great to be on the show. You're dealing with an important topic.
Thanks so much. And so I figured we'll just get right down to it. Most of us have been fixated on these immediate impact of COVID. People are sick in the hospital, obviously unbelievable number of deaths, this kind of impact of the economic tragedy that has happened for so many people. So my question is, do you believe that there will be, or even already is, a mental health toll from the pandemic, separate from the direct, physical illness that we see and know so well? Important question.
The answer is yes, and it already is there. And to just elaborate, I think I have found myself saying in some of the discussions that we have in medical circles and with others that we've got two pandemics. One of them is a viral pandemic. The other is literally a brain mental health pandemic. And we can get there if you wish. Aspect to the second, not unless we respond to it appropriately and try and get it up.
And do we have any sense of kind of the numbers? Like if we look at the overall, just infections of COVID and we think about that, is there a sense at all of what the scope or scale of the mental health impact of COVID is going to be?
Oh gosh, we're getting all these reports that are coming out right now. So there is a sense, and it's emerging and looking real, to the point that some people say the mental health pandemic may be as important for some segments as the viral pandemic. So what's happening is if we look at anxiety, depression, and just stress that comes, the reports on those elements clearly show that populations are jumping, and they're describing in no uncertain terms, I'm much more depressed, I'm much more stressed, I can't sleep, I'm drinking too much, I do nothing but worry, we're fighting at home. And these elements really, that might be just stress, but it's translating for those who have the vulnerability into overt episodes of depression, and even in some cases, increasing thoughts of, do I want to go on living? And thoughts of suicide. And the profile of anxiety, depression, and suicide thoughts is a well-known one. In this case, it's just being precipitated by that evil virus.
Wow. And is there, I want to get to kind of the actual, anxiety, mental health impact, but before I get to that, is there, obviously with the disease itself and infections and those who have to go to the hospital and death rates, it is having a far greater impact in communities of color. And so we see a racial impact. Does that exist for the mental health space as well?
I think so, for the simple reasons, probably. I don't know that anybody has reported yet that they think there are different underlying neuroscience mechanisms that would account for that. but the risk of infection and the rate of infection is higher in the populations, if you will, that are out on the front line, and that's the medical group. And then when you start getting into the community, who are the people delivering and driving trucks and hauling garbage, and as well as many of the tasks of being wait persons in stores and stuff. And I think that does have an element of exposing a segment of our population to far greater risk. And we have to recognize that. We've got to do something about it.
Right. And so, you know, with COVID, with infection, right, we hear from doctors, you've got a fever, you've got a cough, that's when you go to the hospital, you have these symptoms. For the issues relating to anxiety and or depression, are there symptoms that members of my audience should be aware of, on the lookout for, in a similar way, so that doesn't reach a point of being, you know, overwhelming or too impactful before we seek that important help?
Yeah, and I've ticked them off once already, but just to go over, there are symptoms and their profiles and their syndromes, if you will. Depression, anxiety, sleep comes to the surface as part of those two. And then I think probably some of the things that are a bit scary to us in the medical profession. Tick them off first, real fast. The depression, it's a profile that's fairly classic. I am not enjoying anything. I don't have any energy. I've ceased talking in the way that I did before. I've got pains. I'm constipated. I mean, when depressed people get constipated, it's not in their belly, it's starting in their brain. And foods don't taste as good, and they don't talk about doing anything that is enjoyable. And then the sleep pattern enters in, and they try to deal with alcohol. It's a bad solution because it gets metabolized quickly, and at 3 a.m. they're awake, and that's when they start having evil thoughts. And anxiety, that tends to go together. These two syndromes do coexist, and that's the tension and the tightness and the facial expressions and the the blood pressure changes and cardiac. And so all of those things are happening right now, and they're even happening in the millennials. That's an indication that while they may not have the same propensity to infection, they're impacted too. So depression and anxiety, and probably already some reported increments in suicide thoughts and even attempts in emergency rooms. It's not a happy profile, and it's stuff we have to do.
And with the aspects of depression that you shared, that was really very helpful. Is there kind of a threshold, that I or someone, in my audience would begin to get concerned? In other words, right, we all have certain bad days or things like that, or trouble sleeping. Is there a threshold at which we should go, you know what, this may not just be a passing, this may not just be because I've got these issues at work or these issues in family or with a friend. This is something I may need to seek out. Is there kind of a threshold we should be on the lookout for, or how do we determine that?
There is, and I think the threshold is, are there breaks? Are there gaps? We do all have those bad work days. That's different. And when people get depressed, it sticks, and it actually stays, and they can't break out of it. So if something is sustained enough, severe enough, increasingly interfering with the physical functions, losing weight, some people gain weight, but most lose weight. Losing sleep, it all gets to be cumulative. And then they start actually, in some cases, having either their own worries or family members. Are you okay? Do you have this virus, or do you have cancer, or some stuff like that, because they don't look good. And that profile gets to dominate. And at some point, when it goes on months, the people see the consequences. We've got to do something before that happens, which is why we've had to do an adjustment. We've gotten into virtual care.
Gotcha. Yep, absolutely. Which seems to also give a lot of great access. So I certainly encourage any of my audience members to potentially consider that. So we're running short on time. And one just additional question before I wanted to ask you an arts question that I ask all the time. But anxiety, depression, like a lot of times I've even thought they're kind of almost synonymous. Is there a specific real difference, or is there usually a crossover? How should we kind of think about the distinction between the two?
The distinction is probably overdone in my judgment. They do have separate diagnostic categories, and we even have teams that specialize, but they are so coexisting. 80% of people who are depressed also have anxiety, and I think it's best handled. The treatment approach really hits both of them, and I think to sort of say, well, you don't have that, you have this, actually misses the boat. And the treatments, by the way, do work. We've just had an explosion of knowledge about the underlying neuroscience in the past 15, 20 years. But we've got an awful lot of work to do to figure out what works for each person. And that's the so-called precision treatment. We're making progress on that. But people have to get there and they have to get treatment.
Gotcha. Gotcha. Awesome. Well, unfortunately, we're just about out of time, but I always like to ask my guests, do you have like any arts interests, or is there actually an art form that you practice yourself?
Well, first, I have an arts interest, which is why I wanted to be on this interview with you. But the arts interest can't be accompanied by, oh my gosh, am I good? I just have the interest. I have long felt that arts need to be part of our delivery to deal with the problem of depression. And I think I've been drawing since I was in fourth grade, and my teachers used to say, why are you putting those extra things on? I oil paint, and I'm not good, but I love it. And I think I used to use cartoons and make my own captions for lectures. I believe that we've got to approach these problems because these issues still are stigmatized. We've got to bring the arts in to be able to break through the hesitation. I'm not going to go see my shrink. It gets in the way. So if we ended up explaining with art, music, poetry, anything along the lines that sort of makes it easier to take that step, we have done a great service. So I commend you and the people doing this. A little tidbit, I guess, is when I started the Depression Center at the University of Michigan, and we were the first, I used the phrase about the building, and we wanted to make it nice. And I said, it needs to be the antithesis of depression. So we need to bring in the arts, paintings, illustrations.
Totally.
We tried to do that. Absolutely. So in some strange way, you play a role in solving this latest one, and we can do it. And one more comment, if I have the time. I actually believe that what we should be doing when we're looking at the hesitancy now of the population at large about going to get virus vaccines. So the vaccinations are out there and they should be used. They are safe. We've got to use the arts to break through the hesitancy. Some of that is different groups of our population. We've got to address things, and I think it takes what do we say, an integration of all of those things. People should get creative, and maybe we need a song about taking on COVID, and or we need something that a conference, and we need people on the committee who will address how do you incorporate the arts.
John Greden, thank you for helping us gain knowledge through the lens of creativity here on Artful Science. Thanks so much.